Welcome all to the FIP webinar on pharmacists' contribution to displaced populations in recognition of World Refugee Day. Very welcome. We see several participants still coming in, but we will be starting our program. My name is Robert Moss. I'm a vice president of FIP, hospital pharmacist in the Netherlands, and one of my portfolios within the Bureau of FIP is the Humanitarian Resilience Advisory Group, and hence I'm in the moderator here. But I would like to hand the mic to my colleague Lucas to introduce himself, and he's the real expert on humanitarian resilience. Lucas, please.
Hello, good morning, good afternoon, everyone. My name is Lucas Ercolin. I'm a humanitarian pharmacist working now from Brazil, but had the opportunity to work in many other places. And I'm very glad to have all of you here today to hear a little about humanitarianism, about displacement, refugees, and many other humanitarian points important for you as a pharmacist. Next slide.
And then comes the bit of the boring part, but we have to go through, and we'd like you to pay attention. The webinar is being recorded and live streamed via YouTube, and the recording will be available on our website, www.events@fip.org, for future use. You may ask questions, and we would like you to use the question and answer box provided for using your questions. We will deal with the questions while we're during the presentation, but we'll handle the questions mainly at the end of the program. And you are, of course, welcome to provide feedback at the mail address mentioned, and we would very much like you to become a member of FIP. Next slide, please. One additional feature that has been added recently to Zoom is a translation feature on Zoom. You can turn on the captions. It says show captions beneath on your screen, show captions, and you can enable a translation toggle, which will then give you a simultaneous text in captions. Should your preferred language be, you can choose your own language, which works best for you, and then you can follow having live translated captions. And now over to the real program. Lucas, please.
Oh, hello again, everyone. So today we have the World Refugee Day. So the World Refugee Day, and then in August we have the World Humanitarian Day. They are both designed by UN to honor the refugees and other displaced people across the world. So today, in this year, we are in solidarity with refugees. How much displacement we are seeing in the world today, in different fronts, in different continents, for different reasons, from war to natural disasters. So above everything, this solidarity means saying clearly with courage that the refugees are not alone and that we will not turn our backs to them. Next slide. We from FIP, we have the FIP Humanitarian, which you can see in our microsite, the humanitarian.fip.org, which compiles everything that FIP is working and information for you as a pharmacist on humanitarian. Next slide. It is aligned with the FIP development goals. You can also look in FIP for more information. And among the different points that humanitarian brings, we will focus, of course, for the 18 that is about access medicines, device service, to ensure a health that leaves no one behind. And today, to talk about this, I'm very proud to bring 3 speakers. So we have Christina from MSF that will talk about pharmacies on the front line, supporting refugee health in humanitarian settings. We will have Kira Hushod, supporting displaced people through the pharmacist lens, bringing his insight from South Africa. And we have also Yara Salam, who is working community health worker from Lebanon, that will talk about community engagement and support to refugees. After their presentations, we will have space for questions and answers. You can use the platform of Zoom for that. but we will also have the chance to ask for them to answer. And then we wrap up and conclude for today. Next one. So for today, we expect and we would like to have as learning objectives that you understand the role of pharmacists in the humanitarian context and how we relate to the refugee and other displaced populations, promote solidarity through our professional practice and advocate for refugee rights, and recognize the impact of displacement on health needs and how it changed the situation for those who are displaced or refugees. You can move. And then I will bring back to Rob.
Thank you very much, Lucas. Well, I'm very proud to be able to introduce the first speaker, Christina Skender. We know she's traveling, so there might be some hiccups, but we hope it'll go smoothly. Christina is a public health specialist, pharmacy advisor to Medicine Sans Frontières and from Sweden. And we're very happy to have her on the webinar. So Christina, please, may I give the mic to you?
Thank you, Robert. Shall I share my screen? Yeah, we already have it. Okay, thank you very much. So today I will be speaking about pharmacists on the front line and what can pharmacists do to support refugee health in humanitarian settings. Next slide, please. So just to give a bit of introduction about Doctors Without Borders or Médecins Sans Frontières, MSF. What is this organization about? So this is International Independent Medical Humanitarian Organization, which works on the principles of impartiality, independence, and neutrality. So the aim of the organization is to provide medical emergency aid and in the settings of epidemics, natural disasters, conflicts, malnutrition crisis, exclusion from healthcare, and of course in refugee crisis. Next slide, please. So just to give a bit of statistics about refugees, IDPs, internally displaced people, and people on the move. So according to UNHCR, there are nearly 108 million people worldwide which are forcibly displaced. And out of those, more than 35 million are refugees. And it's interesting to note that in the last 10 years, the number of people forcibly displaced has doubled. And MSF has worked or works still in context with refugees such as Bangladesh, Democratic Republic of Congo, Sudan, Central America, Mediterranean Sea, Ukraine, Palestine, and in many other contexts. Next slide, please. So what do we do in terms of refugees and IDPs' health? Well, first of all, we treat infections and provide basic treatment of chronic diseases. We do a lot of outpatient consultation throughout mobile clinics, for instance. Then we do a lot of vaccination campaigns. We do surgery and trauma care. We provide shelter, drinking water, and latrines. We do a lot of health promotion activities, and we do mental health activities for our refugees. Next slide, please. So what is then the pharmacist's role in refugees' health? Well, we do a lot of medication management and supply chain management. So stock management is very important. We forecast medical orders, and good forecasting of medical orders is very important. We promote good storage and distribution practices. We do a quality assurance of on medical products that we provide, and we do a lot of good dispensing practices. We also do a pharmacotherapy and medication counseling in order to ensure rational use of drugs and optimal use of drugs. We also are a crucial part of infection control and public health. We support activities such as antimicrobial stewardship, or we lead them. We support vaccination programs, for instance, through provision of cold chain support. And we do support in outbreak responses, for instance, through provision and management of medical kits. Next slide, please. So then we do also a lot of local staff training and capacity building. For instance, local staff training is very important in terms of pharmacy education, but we also set up mobile and camp-based pharmacists. Then we address spatial population needs. For instance, we provide special attention to pediatric, maternal, reproductive and mental health, and in terms of special medication management for those populations. And then interdisciplinary and multi-sectoral collaboration is extremely important. Interdisciplinary collaboration with medical supply and logistic teams, and collaboration between different actors on the ground, such as local ministries of health, other NGOs, WHO, ICRC, UNHCR, etc. Then we also aim to do and be a part of advocacy efforts, and especially to promote access to healthcare and essential medicines. And we also do a lot of reporting, and we also want to form and be supporting policy formations and guidelines formulations. Next slide, please. So what are the challenges that we face working in refugees and in settings such as these? Where first of all, supply can be very irregular. So we face that the biggest international medical orders come only a few times a year. So it is very important and crucial to forecast appropriately. And it is difficult to forecast in unstable and dynamic contexts that change. And for instance, the number of IDPs and refugees can be changing. Then the transport of medical items is often difficult and expensive. It faces a lot of import constraints and delivery delays, and therefore we are faced with frequent stockouts. If we want to purchase medical items locally, the local markets are often unreliable. So either they lack essential medical items, or we found medical items of substandard quality in the places where we work. Next slide, please. From further challenges, we face challenging storage conditions with either very high or low temperature and humidity. And with high humidity, we often face dust, pests, and rodents. It is very challenging to maintain cold chain, and we face frequent electricity power cuts. And we also have to work in multidisciplinary teams, which means that we often face language and culture barriers. And there is, as I already mentioned, often lack of local pharmacy capacity. Next slide, please. So just to give one example where I worked and one case study, and that is Rohingya refugee crisis. And for instance, the refugee camps in Cox's Bazar in Bangladesh, in south of Bangladesh, are considered world's largest refugee camps, where more than 1 million Rohingya refugees from northern Rakhine province in Myanmar have come before, and most of them in 2017. And these people face poor, crowded, and unsanitary living conditions, which then lead to various diseases such as diarrhea, scabies, lower and upper respiratory tract infections, and even cholera. They often have low immunization coverage, which then leads to diphtheria and dengue outbreaks. They face a lot of mental health problems due to the violence they have faced, and especially women's sexual and gender-based violence they faced, and they fled from Myanmar. And then there is a lot of premature birth and low birth weight for the neonates and babies that are born. And of course, they also have chronic and lifelong conditions such as hypertension, diabetes, and even hepatitis C. Next slide, please. So despite all these challenging circumstances, what can we achieve? Well, our aim is to reduce morbidity and mortality. So we prevent and treat infectious diseases, and we provide basic treatment of chronic diseases. So we have to ensure availability and continuity of medical supply, use of quality assured medical products, rational and optimal use of medical items, and we have to increase local pharmacy capacity. And then our ultimate goal is to provide free and accessible essential medicines and healthcare for all, including refugees. Next slide, please. Yeah, that is all for now, and thank you for listening, and sorry for the background noise.
Great, Christina. Thank you so much for this very interesting presentation on the important work that MSF is doing and providing some behind the scene information. I hope you can stay on the call when we go for the Q&A, but please, well, if not, we of course all understand, but thank you so much for this contribution. And next, please could I have the next slide. I would like to introduce Kieran Renchard. He is a community pharmacist in Cape Town and a committee member of the Western Cape ICPA Regional Committee. Interestingly, he is also a traditional Chinese medicine and acupuncture doctor. Kieran, please, can I give you the floor?
Hi, good afternoon, everybody. So this afternoon, I wish to just discuss the role that pharmacists in South Africa do play as regards refugees and internally displaced persons, and how pharmacists can play their role in assisting these communities. The next, okay, so this is just a brief overview of what the healthcare in South Africa is about. So initially you would go to the normal clinics, whether it be a community pharmacy or whether it be a clinic, a government clinic, where you'll see the nursing sister or pharmacist possibly, and then they would decide on referrals to a community health center where there are doctors. So the clinics are mainly primary care clinics, where they would see your normal primary care conditions of skin and sort of normal respiratory tract infections. So this is where the screening gets done, and then they get referred to the community health centers if need be, where they would see the primary care sisters and doctors, and thereupon they would be referred to the hospital in that event. So you can't walk into a hospital facility, which is a tertiary institution in South Africa. You have to go through the chain of going to the community health center or to the clinic, and thereupon be referred onward. This is basically a brief overview of what the legalities are in South Africa. So everybody in South Africa is entitled to free healthcare, and that is embedded in the South African Constitution, as well as the Refugees Act of 1998, as well as the National Health Act 2003. So basically, forcibly, come what may, no matter what the cost or condition of the patient is, you are forcibly going to get care in South Africa. So there's a history, there's a legacy of displaced persons in South Africa due to apartheid and forced removals, as well as the ongoing migration from higher up in Africa. And this has led to a vast population of displaced persons and IDPs. So these groups face significant barriers to healthcare, including legal challenges, economic challenges, social challenges, which pharmacies are uniquely positioned to address. So in apartheid, we had forced removals to the townships and migrations in communities for economic reasons, rural urban migration, Group Areas Act, where people are grouped, where disadvantaged people were grouped together in groups. And then the homeland system, where some people were moved to a different area completely. And these are the segregation legacies of apartheid. And those legacies and forcible apartheid reasons have moved Black people into informal settlements where there's overcrowding and spatial irregularities of unequal access to normal resources. And that's besides the legal barriers of medical xenophobia, ignorance of refugee rights, and inadequate resources. So there's many challenges due to the spatial location of these communities out of sort of the urban areas into more rural areas. Where do these people come from? So we look at areas mainly from up Africa. You'll see Burundi, Congo, Rwanda. So basically all over Africa, really. And as of sort of 2-3 years ago, the amount of documented refugees was about 250,000 people, but that's documented. So I'm sure the figure is a lot more than what it was 4 years ago. So these people need to be integrated into local communities and require access to care, which becomes very challenging because you are dealing with the local population, plus you are dealing with all these refugees and internally displaced persons. So managing these migration patterns become quite complex and challenging. So where do pharmacies fit into these pictures? So pharmacies are, well, independent pharmacies are located in these communities or close to these communities to service these specific communities. So they are really the first point of contact because as a refugee or an IDP, you are forced to go to a facility. So you either go to the government clinics where you would wait probably the whole day to be seen unless you have an emergency, or you go to the doctor and pay whatever the doctor's fee is, or you'll go to your local community pharmacist and get assistance on that level. So pharmacists in South Africa have always been upskilled to be able to manage and deal with these primary care contact points. And obviously now they want to go to someone that's trustworthy and reliable that can assist them. So the pharmacist's role has changed in South Africa in terms of just being a dispenser. You are doing health education to uplift the community and empower the community in terms of lifestyle changes and health awareness, screening facilities, vaccinations, besides managing the patient's chronic conditions and looking at the compliance of those medicine usage, and counseling, because they come with obviously trauma from wherever country they come from, and they come into South Africa. That whole move, that whole shift and integration is quite traumatic. So the pharmacist is there to intervene, to counsel, to assist, and recommend and refer onwards. So together with government, we have partnerships where we offer family planning services to these patients or immunization services to the communities to assist in alleviating the health burden in South Africa for these people. So the challenges, there's many challenges. One of them being the interruption of chronic usage, chronic illness and the chronic medication usage, interruption in terms of supply to them because they've got to walk a distance to get to the local communities or to the government NGOs. And there's also the ignorance in terms of just what the medicine does and how they work. So the pharmacies are very well placed to manage all of these challenges. So there's been partnerships with the ICPA in terms of providing assistance to these communities with outreach programs in these communities where pharmacists would assist in dispensing the medication that gets donated to these clinics to try and get the medicine out to these communities that don't have the facilities to provide them. And this is all done together with the local NGOs, mobile pharmacy outreach programs and that. And this applies to the HIV distribution programs for refugees as well. So I did allude briefly to the mental effect of these challenges. So one can just imagine the trauma that these people have gone through due to the apartheid legacy and forming the IDPs, and besides the migration from up north into South Africa. And a lot of these traumas manifest emotionally and physically, and the pharmacist is there to identify and manage and assist wherever they are in trying to improve the quality of life of these people. So challenges and assistance that we have been able to provide is trying to break or bridge that cultural differences between different communities, the language barriers by having tailored health messaging, but also I've mentioned before about immunizations and vaccinations and screening for infectious diseases and the mobile clinics. But so basically we try and do it in a manner that's culturally sensitive and in different languages. With different vaccination campaigns. An example is South African independent pharmacists provided 7 million doses to the community during COVID to assist with the vaccination rollout. And this just shows the extent of assistance that pharmacies are able to provide. Besides that, there are also programs like something called PIMOD, which is an initiative that was developed, and it stands for Pharmacist-Initiated Management of ART. And that's to try and get them to come to the pharmacies, and the pharmacist is able to initiate and manage the ART therapies, initiation and management. So that's just one of the programs that has been developed and sort of been brought about. This program like smoking cessation, which also they have done to try and empower the pharmacists to be able to assist these communities. And a lot of this is done in collaboration with the local NGOs and government agencies. So the challenges obviously in that is funding is a big problem because a lot of it is funded either by government or by private agencies, for which there are also always hiccups and interruption of medicine and thereupon care as well. So you try and form good relationships and partnerships and try and get as much as you can from the government to be able to assist the communities better. So telepharmacy, video med is one of those solutions where you have like a video teleconference with your patients or doctor that can assist patients that are coming to the pharmacies with better care. Obviously, to try and lobby for better sort of legal recognition of these communities would help in improving the plight of these communities. So I've spoken about the collaborations that currently have been used. So working with NGOs and government bodies to expand the reach, and telepharmacy and digital health records can improve the service delivery and the advocacy to overcome these legal limitations. So some of the challenges that have been felt is at this point, despite all the legal barriers and of documentations and documented people, there are still challenges that are faced. the legal issues around documentation, resource constraints, and the need for specialized training to effectively serve these displaced populations. I mean, there's like for workforce shortages and the complexity of navigating a very strained healthcare system. And pharmacists are expected to take on even greater responsibility to provide these services. So this is an NGO in South Africa, Scalabrini Foundation, where they offer health services to displaced communities. And I'm mentioning this as a Chinese medicine practitioner because I've worked at these centers where you would see these refugees coming in and they pay whatever they can afford to pay. And the practitioners get paid a stipend for being there in the morning, just a morning clinic. And they would see between 5 and 25 patients per morning, per week, offering acupuncture and assistance to them as regards counseling, as regards assistance with health promotion and health awareness and lifestyle changes, together with emotional support as well. Obviously, the ongoing issue is always the funding for all of these, and it's a very big challenge for NGOs in South Africa to be able to provide the services that they do offer. I think it's a valuable service to be able to provide for these refugees and IDPs in whichever form, holistically or with Western medicine. That's my talk for this morning. And I want to just commend the pharmacists that are doing the work they do to assist these communities in upskilling themselves to be able to offer a better service. Thank you very much.
Oh, thank you very much, Kiran, for this very interesting talk, and it shows the many roles pharmacists can have in either the humanitarian setting in the beginning, the first lecture, and then the more how do we get it in a substantial way and in a way that is sustainable in the longer time. And we'll be coming back to this in the Q&A, I'm pretty sure. So thank you very much for these insights, Kiran. And then next, I would like to introduce our next speaker, Yara Salam. She'll be talking about her presentation, is a very personal presentation on her work being done. So in that presentation, she'll be sort of introducing herself. For now, I'll just say she's part of the EOARE team member and lives in Lebanon. But please, Yara, we're very interested to hear your story and see about your background. Thank you very much for being here, and the mic is yours.
Thank you. Good afternoon, everyone. It's truly an honor to be here with all of you today. This isn't just a presentation for me. It's a deeply personal journey. I'm incredibly grateful to be part of this important event where we come together to recognize the resilience and strength of refugees around the world. I come today as someone who has listened, witnessed, and stood beside people in their hardest moments. Today, I'll take you through the human side of crisis, a journey of healing, hope, and humanity. Next slide, please. Yes. So my name is Yara Salam. I come from Lebanon and I hold a background in biomedical sciences and public health. Over the past few years, I've dedicated my work to standing alongside displaced communities, whether in refugee camps or field clinics. My background in biomedical sciences and public health, but nothing could have prepared me for the education that I would receive outside classrooms and labs, from refugee camps in Bekaa Valley in Lebanon to frontline clinics in Beirut during conflict with Doctors Without Borders, and to my current work with DCA Lebanon. I chose this path not only for science, but for rightnesses, because every person deserves to be heard, seen, and to be safe, no matter where they were born or where they were forced to flee. My journey began in 2021. Next slide, please. in 2021 when I joined the Youth Advocates Program with Loyak Lebanon. I was based in Bekaa Valley, home of thousands of Syrians and Palestinian refugees. We weren't there to speak for them, we were there to listen. My role involved conducting research, holding interviews, and identifying the key challenges facing these communities, such as lack of healthcare, mental health support, and education access. I still remember a teenage girl there who told me that she wanted to become a lawyer so she could defend her people. Her strength and clarity inspired me to continue this work. One mother said to me that we are not broken, we are rebuilding. That shaped everything I see today. Next slide, please. Later on, I worked with Doctors Without Borders in mobile clinics during the war in Lebanon. There, I worked with displaced families facing immediate threats to their lives and health. I helped distribute supplies, organize care spaces, and provide emotional support in an incredibly chaotic environment. And we also provided clinical care. What struck me the most wasn't the pain of the people there, but it was their persistence. There was one woman who had lost her child that morning, and by the afternoon she was helping others grieve. This is a strength that no book can teach you. It's a strength that I carry with me today. Next slide, please. Now I'm working with Dan Church 8, DCA Lebanon, focusing on landmine risk education in southern Lebanon and in Bekaa, Lebanon. These areas are contaminated with unexploded ordnance that endangers Syrian refugees and local Lebanese communities there. We deliver workshops to help children and families understand how to stay safe. I remember a boy who came up to me after a session and said, "Now I can protect my sister." That was the moment that reminded me that education saves lives and that everyone must have an education, that survival isn't luck, it's knowledge. Next slide, please. So the thing that I've learned across all of these experiences is that refugees are not helpless, they are limitless. They are not just survivors, they are teachers, doctors, students, builders, and artists. I've met children running community art programs in camps, mothers starting small businesses, and fathers teaching children under tents and covers. These are people who refuse to give up. They taught me that resilience isn't rare, it's daily. They are people who've lost homes but never their strength. It's waking up and continuing despite everything and still choosing to hope. Next slide, please. What I've learned beyond medicine is that medicine helps, but so does presence. I've learned that presence itself can be healing. In many cases, I couldn't offer medication, but I could offer understanding. I could explain health messages in ways that are simple to understand, and I could sit with someone through fear and confusion. In these moments, the powerful thing we can offer is humanity. Sometimes we don't carry stethoscopes, but we carry hope, and that can be enough. Next slide. Now, this brings me to you, healthcare workers and professionals here with us today. Your role is far more than clinical. This is where your role as a healthcare provider and a pharmacist becomes transformative. Whether you're a pharmacist, a nurse, or a public health worker, you have the power to change someone's entire experience of care. In case of displacement, your presence can offer a trust, clarity, and comfort. In every interaction, you can ease fear, offer accurate information, and support mental health. Even a small gesture, the way you explain medication, the way you listen, can restore dignity in moments where people feel invisible. You have the ability to become a trusted face that often feels cold, in a system that often feels cold and distant. You can simplify complex care, and you can empower people to take ownership of their own health. And you can do it all with compassion. Every moment you spend with someone displaced is a chance to restore dignity. You are the calm in their chaos, and never underestimate that power. Next slide, please. As a closing for today, World Refugees Day is not just a time to reflect, it's a time to commit. Solidarity means walking beside people and not ahead of them. It means listening and not assuming, acting and not speaking. Refugees are not weak, they are warriors of hope. And as people in health and humanitarian fields, we have the power to walk with them towards safety, healing, and justice. To be displaced is to carry a weight if you can understand, but despite that, refugees rise, not only for themselves, but for their communities. Let this day be more than a reflection. Let it be a call to keep showing up with empathy, with knowledge, and with action. Thank you for listening to my story and more importantly to theirs. And thank you for giving the space to stories from the ground.
Thank you very much, Yada, and all the other speakers for sharing with us today. I will open now for the questions. We have some questions from the QA tool. You can also put your questions there, and I will give the chance for the first question that we received, because it's from José. It is, okay, what about what we call in the humanitarian world the exit strategy? So we hope, of course, as humanitarians, that the emergencies that we see, human or natural made, that they will come to an end and the people will be back to be able to develop, and those who migrated and became displaced will be able to have a good life, or where they got to the new host community, or if they want to return or move forward, that it can be done with health, in a healthy way, in a positive form. But the emergencies that themselves, they end. That is a central aspect of that. And ensuring that we go from a humanitarian situation, as Yara and Christina said with the MSF, that we go and do the activity towards what Kiran said, that is integrating this care to the normal healthcare, becoming sustainable and stable. So I would like to hear in special from our friends from MSF who deal more with the exit strategy. So Christina, if you want to, Christina or Yara, if you want to talk a little about your work and how you think about exit strategy, please take it back.
Yeah, I can maybe start with this. No, that's a very good question, and exit is sometimes the most difficult and most complex part of our work, because, as you said, we are very good in emergency, we are very good in jumping in and sorting things out and starting activities, but then leaving activities is somewhat more difficult and requires planning and structurization. And still, we often have like lessons learned from what we did wrong. I would say what is most important is to find local capacity. So either local NGOs or NGOs that stay there longer than us, or are, local. So in the way they will preserve the work that we have been doing, or Ministry of Health. And we can support them through various ways, through material ways, donations of medications, even money, financial, and building local pharmacy capacity, building local capacity, medical capacity in general. So there are various ways of supporting, but this local capacity needs to be there. Otherwise, MSF is reluctant to leave. So unless we have good hands, or we are fairly reliable that these good hands will take over our work and can resume our work, then usually we don't leave unless there is something very specific. But yeah, we tend to have partners to whom and which we can hand over. I hope that answers partially your question.
No, it truly answers, Christina. I can see here, I don't know if the other speakers want also to add on that. Otherwise, I'll go for another question. I can see here the latest question that we got from Hajar. That is a quite interesting one on the part of studies. I believe that for all the pharmacists here hearing, you did not have a class on humanitarian pharmacy and how to operate in situations of emergency. This is not a core studies for pharmacists anywhere in the world. But yet, some people study, they graduate, and they become pharmacists in countries during entire periods of emergencies. Some emergencies and wars go over 10 years, and people really can start and become pharmacists during the entire period. Yada, I hope that I'm not assuming too much, but you, as a pharmacist from Lebanon, Do you have any experience to share with us on this part? How was your education in Lebanon and how this created you as a pharmacist to operate in an emergency? Would you like to share?
Yes, sure. As a student in Lebanon during my undergraduate years, war has always been a part where Lebanese people and refugees in Lebanon are afraid of, and war actually happened in Lebanon. So in this part, education was transformed to online education, and not all students could have could have started online sessions due to the war conditions and limitation of supplies and electricity. So during that time, NGOs has started to spread education more, go to schools where displaced people are there. And as I was working with MSF, we went to displaced populations and schools in Beirut, and we distributed different medical supplies and also different educational components to ensure that everyone was also on track. Thank you. I hope this helps.
Really does. Thanks for that, Yara. I'm seeing here other questions, but I would like to add one from myself for Kiran. So, Kiran, here, well, I'm from Brazil, and we have a similar approach as South Africa. So that health is for everyone in the country, no matter where you are from. So it is an interesting way to see this exit strategy, as Christina said. So moving from the NGOs and from other actors towards the Ministry of Health and getting this as part of the core that we have as the health of the country. Do you have anything to share on the South African experience of this absorbing some support? We have some colleagues also from MSF South Africa that works in FIP. So we know that this process is something that comes through. Do you have any insights to share with us?
Thanks, Lucas. I just want to get the clarity on the question. Are you asking about exit strategy or in terms of just relationships with NGOs?
How, okay, let me try to put it like this. Considering that for South Africa, is the health is a right, even for the refugees and for all the displaced people, how does it see, does South Africa have some process to bring the work that NGOs does and implement and integrate this to the Ministry of Health?
Yeah, I'm not aware of any of those being introduced in South Africa at all. At all. I think a lot of them will work independently or together with other NGOs that are recognized in South Africa. There might be a partial government involvement, but I don't think there's a full government involvement. I think the government has their hands full financially with other issues, and health not being the primary sort of aspect, or the funding that they do allow for health is not sufficient. This is why we have these NGOs from all over the world working in these communities to assist the communities because of the large need. So independent pharmacies would assist these NGOs in those communities with medication as needed. So there's, for example, doctors that are working in these communities that are funded by overseas NGOs, and they would require assistance from maybe the pharmacies, independent pharmacies in those communities. So it's more on that level, more than from the governmental level.
Okay, thank you very much, Kim. I will now open a question for all of you. Okay, so I will put that since, as Christina said in her presentation, that in 10 years doubled the number of forcibly displaced people across the world. And this year is an intense year for displacement. From the end of the last year, the beginning of this year, we are seeing waves of displacement. I'll take the case of Lebanon, the displacement between Lebanon and Syria and Turkey, and all the movement that is happening there since few months already, since the end of the last year. plus the other displacements that we are seeing from DRC and other countries. So yes, there is an increase of displacement and emergencies across the world. So from your side, from your position, Christina, as working more globally with MSF, Yara with the work in Lebanon, which is a center that for migrations nowadays, for forced displacement, but also for South Africa, as Kieran said, with people from DRC and other countries around. How do you see the context today? Do you see some things needing more support, needing less support, changing what is required? I'd love to hear the insights from you. Feel free to take the mic. Eden?
Yeah, it's kind of difficult because I think being the third world country, you have challenges of funding. I know I'm sort of laboring the point of funding, but I think it is a very real problem, especially if you have a population that's growing at a phenomenal rate because of inroads from other countries that are poor economically, and they all move down and migrate downwards for a better life to South Africa, and it impacts the healthcare system. So it is a very difficult one. I don't think that the amount of healthcare has kept up with the influx of migrants from up north. And I think that's the challenge. This is why I think pharmacists are being empowered to be able to offer services that would not have been done 20 years ago, to be able to cater for the needs of the migrants. Because at the end of the day, these extra tasks does not normally fall into the scope of being a pharmacist. So this is why I think they are being upskilled to assist in the mere fact of the vaccination rollout during COVID was to assist the government in vaccinating the population, which is not something that we would have thought would have happened 20 years ago. So we are being upskilled to be able to inject, be able to immunize, be able to initiate and continue ARV programs to increase the access to healthcare. I think that answers your question.
Yes. It's always good to see the perception on funding, which is a central aspect today on the humanitarian world. Any other would like to comment on this?
Yeah, maybe I can add. I completely agree, and I wanted to say the same about. So there are two aspects that I see that refugees really need, and maybe not so much that us as pharmacists can do, but we can try to be more integrative in the medical care as all. Like Kiran said, vaccination. This is something new for pharmacists, and refugees come from wherever, and they have different immunization coverage. And then they come in the host country, and this needs to be taken care of. So the vaccination is definitely something that we can support through various parts, either logistically or even taking on ourselves as a new, let's say, new capability of a pharmacist. And there is other aspect also that is really needed, and Yara touched a bit upon that, is the mental health. So, of course, we are not psychologists or psychiatrists, but just through the talking while dispensing medication, counseling, patient counseling, we can also help in that aspect. And I think this is also really needed. Just to reassure people, make sure that people will take their medicines as prescribed and that these medicines will work for them. So, yeah, I see those two aspects as something that we can, as pharmacists, do.
I want to add to
yes.
Okay, that's fine.
Can I add?
Yara, please.
Yes. So about the mental health aspects, I agree with Christina. For example, during war in Lebanon, different refugee populations and Lebanese populations were actually very devastated. through the crisis and throughout the whole things that were going in Lebanon. And as MSF took a very huge role in supporting mental health of refugees and displaced Lebanese population, and they were actually following up with different affected populations throughout the war, and even after the war, they kept following up with these populations.
If I can may add something to that, something that is also like emerging global health issue, antimicrobial resistance. And there is something that pharmacists can definitely do, because we also see people, refugees, depending on their culture and where they come from. Usually antibiotics are taken like candies and for everything and preventative. So there is also aspect of pharmacists, definitely an antimicrobial stewardship, where we can also teach and guide and make sure that antibiotics are used appropriately as they can.
I think Dakira wanted to say
Yes.
something.
Sorry, I
Go
just
for it.
wanted to sort of, if I look at it more from a holistic aspect globally, I think I want to just echo what you've mentioned, where we need to maybe just start at the ground level in terms of empowering the newer pharmacists, in terms of counseling, and in terms of humanitarian care. Obviously, in my case, I'm qualified a long time now, so I don't know what the new curriculum holds, but I think it's a very important point going forward, looking at the world where it is at the moment. Maybe the whole curriculum needs to be re-looked at to include a component of humanitarian care.
Thank you very much. I want to thank the three of speakers. Thank Christina, thank Kiran, thank Yara for this. Here, I think we had today a great opportunity to see three really different views on that. Kiran bring us the view for South Africa as a country, and also from the community pharmacists. Christina, I think I feel more connected to your work, because as I see your slides, I saw myself in the field working and doing the inventories across missions. And for sure, Yara, the work that I see in Lebanon, not only from what you said, but I also had the opportunity to meet many people from Lebanon that are committed to the humanitarian, and observing the last events and the ongoing events of the region. Really, we see a lot of energy from Lebanon on this humanitarian matter. So for me, it was a great day today to talk about refugees, about humanitarianism. Can we bring back the slides? So I hope that you all enjoyed the meeting, the webinar of today. And we can just go to the next slide. You can check all the events of FIP, including this one, on events.fip.org if you want to see again and review. And on terms of events, we also have, of course, this year World Congress in Copenhagen, FIP Congress. They are great. I've been to some of them myself, and they also are a good space for meeting other humanitarian pharmacists that work with us, the ones that work for the humanitarian group, and also for the military and emergency section, which tends to be a great place for networking, which is something usually hard to do as humanitarians, even more for refugees, of course. So we have some sub-teams to make sustainable, make the system work, and make it personal. And now in August, the second registration go, so it don't get too expensive later. And we have an entire Snapchat for you to see in the website. So go for it, copenhagen2025.fip.org. And this is from me. So thank you very much. Rob, if you want to make some last words.
No, thank you all. Thank you very much, speakers, for this very interesting session and all the different aspects. Thank you, Lucas. and it's so interesting to see it resonate with you. So apparently we do hit the right chord, and I hope for the audience that it all hit your chord with you too, either inspiring you to start work there or to continue the important work that you are doing. So thank you very much from FIP for attending, and we hope to see you at future events.